I'm Mark Bowden. I'm an expert in human behavior and body language. All of us rely on being able to judge other people's language by not only being able to hear it, but being able to see it. Our brain that does language takes in a lot of data to work out its best guess at what the words were that were said. Not only does it take in the sounds, but it's taking in the context, how the mouth was moving, and the emotional data to do best guess on what was said. So understand, the more we're masked, we've got to understand that people will default to more negatives around what we're saying and get it more wrong. So we might want to repeat things a few times more.
I'm Lisa Barrett. I'm a clinician scientist at Nova Scotia Health Authority and an infectious disease physician with Dalhousie University. An occasion or two where you can't actually maintain distance and you haven't washed your hands lately, then the ability to keep your droplets behind a piece of cloth is the whole idea of the mask.
So when we're looking at other people, we're trying to get what we call theory of mind, an idea of how they feel and intend towards us. And we do that mainly by watching their non-verbal communication, what's happening in their body, their gestures, their rhythms, their tempo, and what's happening in the face as well, the muscle movements there. We're often looking for, is somebody presenting a Duchenne smile to us? And the Duchenne smile is the universal signal of things are good. Yeah, and so what happens in a Duchenne smile is the sides of the mouth turn up like so, and then the eyes narrow to produce little dark areas. And when we get both signals for approximately more than 3 seconds, we tend to respond well. Things are pleasant. But certainly the Duchenne smile is designed to be seen from a distance. So even in public space, we're looking out for what's the tempo of the person moving towards us, but what's their expression?
It's about coming in and normalizing that process of a mask, which, depending on people's age or what their experience has been, some people have been through, wars and other things, that this is all very difficult for them. And especially with some dementia patients who have a lot of flashbacks or different or altered perception.
If we don't get enough information, our instinct isn't optimistic, it's pessimistic. And if we get very little information whatsoever, we tend to catastrophize. If I give you an example of this, all I'm going to do is cover my mouth so you can't see that and tell you, I've got really good news for you today. And that's very different from me going, I've got really good news for you today. Yeah, so the biggest change that I have observed is people are getting less eye contact, even with people they live very closely to. It's the classic social mammalian gesture of, you can't see me, I can't see you, therefore this isn't happening. It is one of those classic mammalian responses to danger, which is when in danger, we shade, we hide, we try and pretend that we're not actually there by not actually seeing what's going on around us. There's some good medical reasons for this, but understand at the same time, the upside of that, there's a social downside as well, to not quite trusting or feeling connected to even the people who are closest to us in our communities. So what I've seen people do is to wear badges, wear pins or identity cards where they have a photograph of their full face in a full Duchenne smile, so that when they approach, we are getting insufficient data here, but we're able to look down at their badge, see that Duchenne smile, and then bring our eyes back up and project that Duchenne smile onto the person's face, so it doesn't feel such a negative area.
So I have seen people starting to do that. I think that's a great idea, especially if people can see pretty well. The other thing is people have found someone's a caregiver for someone in the community, and they don't need to wear that special medical procedural mask. They get masks that have smiles on the front, which I think are great.
So I would say to people, one of the things that we can do is nudge ourselves, provoke ourselves, force ourselves a little bit more to get better, stronger eye contact with more people during this time, whether we're masked or unmasked.
No crossed arms, no aggressive stances.
Try and let people know that you know they're there, and show them a little bit of optimism if you can.
If I can, if I've got time and it's not a medical emergency, that I tell people, you know what? It's really sad that I can't see you right now. I'm smiling at you. So I often just tell people as well. And it's amazing the number of times I get a smile back from that.